All right, welcome back to Dr. Moses' channel. Do you know about the silent killer disease that almost over 90% of people have in their life? It is called hypertension or high blood pressure. Uh, in the series of videos that I'm going to be making, I'm going to talk about high blood pressure and what to do to be able to control that high blood pressure. Now, before we talk about what to do, medication to take, the natural ways of being able to control your high blood pressure, we want to define what high blood pressure is and then how to correctly measure your blood pressure. Because if you do not know how to correctly measure your blood pressure, you will be taking medications that you should not be taking. And this is one of the biggest mistakes that we see in doctor's office, in the emergency department, and even on admission. Nurses measure blood pressure wrongly, and they put people on blood pressure medication when they should not be on it. So on today's video, let's dive into it, talk about what is the normal blood pressure and how to correctly measure your blood pressure. So when you look on the American Heart Association website, they tell you that the normal blood pressure should be anywhere less than 120 over 80. That means the top number is called the systolic blood pressure, and the lower number is called the diastolic blood pressure. So the systolic blood pressure is basically the pressure that is caused by the heart when it contracts and push blood into your system. That pressure is called the systolic blood pressure. And then the diastolic is when your heart relaxes and blood flow comes back into your heart. It's called the diastolic blood pressure. So when you measure your blood pressure, you have two numbers. The top number, which is the systolic blood pressure, and the bottom number, which is the diastolic blood pressure. But you cannot have one shirt to fit all. The American Heart Association definition of blood pressure is too aggressive. And that is why today we are seeing people, especially the elderly people, having blood pressure in the 120s, 110s, the systolic, and the bottom one in the 70s and 60s, and causing them to have dizziness and falls and also even passing out because you cannot let one blood pressure measurement fit all. The American Academy of Family Physicians, on the other hand, define high blood pressure as any blood pressure that is over 140 systolic and the bottom one is over 90. That I think is more acceptable because as you get older, what happens is that your arteries becomes hardened. And so having a blood pressure of 110 or 120 over 70 over 80 could be very, very bad for you. You may need a higher blood pressure to be able to perfuse your organs. And that is why you cannot say one shirt fits all. However, if you're experiencing blood pressures in the 150s, 160s, and it's consistently, then yes, you really need to pay attention and see a doctor. How do you define high blood pressure? Well, high blood pressure is defined according to the American Academy of Family Physicians, if you measure your blood pressure 3 times in a week at different times, and your systolic is over 140, and the bottom one, the diastolic, is over 90, then you are considered having hypertension. But you need to measure your blood pressure in a very quiet environment. There are certain things you got to do when you're measuring your blood pressure. Number one, you got to be in a sitting position like I am with your back straight, and then your hands are on the table, and so that your heart level should be the medical cup, the device in using to measure blood pressure, should fit your left arm and then should be around your heart level. And also, you should have rested for at least 5 minutes, sit down quietly in a very quiet environment, very quiet. And also, you have not drunk any coffee, or you haven't gone on a marathon or done some vigorous exercises. Because when you do those things, and naturally, your blood pressure is going to go up because of the sympathetic nervous system that will increase your heart blood pressure and your heart rate, which is normal response. So today I'll show you how to correctly measure your blood pressure. And also, if you were diagnosed with high blood pressure because you went to your doctor's office and they took your blood pressure only once and it was like 150 over 90, and they said you have high blood pressure and they put you on medication, that is wrong. You should go home and take your blood pressure in a very quiet environment, because when you go to the doctor's office, you are stressed, you're in a hurry, and so that will cause most blood pressure to go up, and we call that white coat hypertension. And so, but what we see is that most doctors, when you come to the office, they are kind of juggling you around. You are in a hurry, you are stressed out, and you go, you sit down on a couch, and immediately they take your blood pressure wrongly, and then your blood pressure goes up. And so they start putting you on medication. And sometimes you go home and your blood pressure is normal, but you're still taking those medications and they lower your blood pressure so low that you start having dizziness and lightheadedness. And then sometimes people can pass out and end up in the hospital. So that number, 120 over 80, is not one shirt for all, okay? Especially if you are older or you are in your menopause or you're a male over 55 years old, you should take your blood pressure at home. And so today I'm going to show you exactly how to do that. Now, the first thing you're going to do is to sit down. So you have a blood pressure cuff like I have here, this machine. I have the blood pressure cuff. You sit down in a chair like I am sitting on right now, your back straight, okay? You're going to relax for about 5 minutes. Relax for about 5 minutes. Again, you have not drank coffee. You are not working yourself out, no exercising vigorously, okay? Sit down for about 5 minutes. Now, the next thing you want to do is that you do not want to cross your leg. Have your leg should be flat on the floor, okay? Foot flat on the floor. No crossing of legs, because that's going to increase your blood pressure. And the next thing you want to do is you want to put your blood pressure cuff on. And this is the blood pressure cuff. Number one, do not put it on a shirt. So if you're wearing a long sleeve shirt, and that's what they do in a doctor's office, this is very wrong. It's a big, big mistake. You don't want to do that. That's going to increase the blood pressure, and you may not have hypertension. So you want to put it on the bare skin, like I'm going to do right now. Put it on the bare skin. So roll my shirt, put on the bare skin, and the end of the cuff should be exactly on the antecubital fossa. That means where you bend your elbow a little bit above it, okay? And what you want to do is that, see this, the little tube here should be in the middle, just close to where your vessel is. And then you want to wrap it up. And when you wrap it up, your two fingers, when you go in, should be able to fit and not very loose, okay? So you put your two fingers, you put in there, they should not be very loose. And then when you do that, you put your arm on the table and it's at the level of your heart. Do not take your blood pressure on your right arm unless you have a lymph node dissection, breast cancer, and so you cannot use your left arm, then you can use your right arm. Other than that, this blood pressure should be taken on your left arm only. And do not use the wrist blood pressure cuff that is selling around. It's not accurate. They'll give you wrong information, give you the higher pressure or lower pressure. That is not accurate. And sometimes you go to the doctor's office and they use that. It's not accurate. Don't use that, okay? And then don't use the one they put on your legs. It's not accurate either. So it must be on your left side and it must be like this. Then sit quietly. Then when you sit quietly, you push and do not talk when you're measuring your blood pressure, but that is going to increase your level as well. And you should not take your blood pressure standing. That is going to increase your blood pressure as well. So you sit quietly and you measure it, and you note that the first number could be high, which is okay because the cuff may have some certain pressure in it, and so that can cause that blood pressure to be high. So if you get a first number and it's high, what you want to do is that deflate it, sit for about 2 minutes, and then retake it again. And that will give you a normal blood pressure. Okay, so that is how you take a normal blood pressure. And again, I told you about the things you should not do when you are taking your blood pressure. Take it twice or sometimes 3 times. And if you do have high blood pressure, you've been diagnosed with it, what I recommend you do is that have this blood pressure cuff with you, okay? And then about 3 times a week, take your blood pressure at different times, record them in a notepad, and then when you go to your doctor's office, show it to them, because that will give you the accurate blood pressure. And if they need to make changes to your medications, they can follow that. And a good doctor will make changes based on the number you brought from home, not a number that is taken in the office. So these are some of the things that you should know about this silent killer, how to correctly measure your blood pressure. And also, do not drink alcohol or tobacco use before you take this blood pressure. So I hope this video is helpful to you. The next time you go to the doctor's office and they are taking your blood pressure wrongly, point it out to them so they can give you the right number. But again, the best way to do it is for you yourself taking their blood pressure, taking record of it, write them down. Make sure you write them down, because sometimes people come to the office and tell them, what's your blood pressure? So, oh, I can't remember. Write them down. These days you have your iPad or whatever it is, you can write them on and show it to your doctor, because this will help you so that they can give you the right medication. Because sometimes you see patients on 3, 4 medication for blood pressure because of the numbers that are seen in the doctor's office. Use the numbers that you have at home. They can adjust your medication, and so that you are not on several medications that can cross-react and have side effects. So I hope these tutorials have been very, very helpful to you. And I want you to share this with all your friends who have been diagnosed with high blood pressure. Let them watch this video. Give me a like. And also, you should share a comment below if you've had experience measuring your blood pressure wrongly. And let's bring this education to the medical community so that people are treated well when they have high blood pressure. On my next videos, I'm going to talk about some of the reasons for blood pressure and also some of the natural ways that you and I can do to reduce our blood pressure. So until then, you stay well.